All right, this video is going to be over the sternum, the scapula, and the clavicle. When we look at your sternum is part of the axial skeleton. And when we look at your clavicle and your scapula, this is called the pectoral girdle, which is part of the appendicular skeleton, which holds the arm on. So we're going to look at the sternum first. This is all costal cartilage. There are differences between true ribs and false ribs. True ribs are ribs that attach to the costal cartilage, which attach to the sternum directly. These are called vertebrosternal ribs. Any ribs that piggyback onto other pieces of cartilage are called false ribs. Those are called vertebrochondral ribs. And then you do have two ribs that are not articulated to the costal cartilage called vertebral ribs. So on your sternum, the superior breastplate is called the manubrium. The way I remember it is it almost makes an M shape here at the top. This is the manubrium. The line between the manubrium and the body is called the sternal angle. And then at the very tip, you have a pointed process called the xiphoid process. When you look at the top of the sternum, remember above means super or superior. This is called the suprasternal notch, and where the clavicle articulates with the sternum is called the clavicular notch. So your clavicle articulates into the sternum, and the rounded end of the clavicle is the sternal end of the clavicle, and the end that goes out here to your shoulder, which is called the acromion, is going to articulate with this structure on the clavicle, which is called the acromial end of the clavicle. The clavicle is the most commonly fractured bone in the body, and when you look at the clavicle on the posterior surface, this right here is cone shaped and it is called the conoid tubercle. So there's only three structures on the clavicle: sternal end, it's rounded, the flat end, acromial end, and the conoid tubercle. Your scapula does articulate with the clavicle like this. And so when we look at the scapula, this is called the acromial end of the scapula.